Yeah, I think it would be nice if we also could discuss a small poster that we presented, and that was on the opioid use in the Netherlands, because I think. So we know from the US that there is actually what's called the opioid crisis, where many people use opioids, and there is much awareness in USA that opioid use can be dangerous for migraine patients, as this will lead to chronification and medication overuse in chronic migraine patients. And for instance, Richard Lipton has done some terrific work on that, and also the CaMEO study has shown that there's actually 38% of migraine patients in the US, they are overusing or they are using opioids. But there are no data of the opioid use in Europe. So that's why we started a large study in our Dutch cohort with over 5,000 individuals. And what we found is that only a small portion of these patients use opioid. It's less than 2% of these patients are using opioids. What we clearly saw is that it's quite interesting that 2% of these patients had self-administered the opioid, so it was not prescribed. So that's quite interesting. And most of the prescribed opioids were from neurologists and general practitioners, whereas at the emergency room, it was not that many prescribed. And our hypothesis is that this difference between the US and Europe is partly and maybe mostly due to cultural differences. But also by the fact that the guidelines are different in the US compared to Europe. So in the US, it's still in the guideline that if a patient comes to the emergency department with migraine, which is not reacting to anything, opioids can be prescribed, whereas in the European guidelines, we state that it's better not to use opioids at all. And thus we think that we should be aware that treatment guidelines are extremely important. I think that every migraine patient that takes opioids for their migraine, they are not well treated, and we need to get these people to headache specialists, because I think they need other preventive treatments, for instance, and other acute treatments. So, and we have these opportunities now with the monoclonal antibodies, etc. But so we should be aware that, for instance, in the US, I also heard it from Rami Burstein, that some people cannot access actually the healthcare providers. So they have no access to the healthcare providers. So these people are more likely to use opioids, whereas we have to treat these patients and get them to the neurologist to have better treatment for their migraines.